Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Today is another golf episode. I believe this is golf episode 21, and we are learning about translating our training and work that we are doing in the gym, in the rehab or performance space. We want to translate that thoracic rotation work into the golf swing. So we want to translate from the gym floor to the driving range and the golf course. So today's topic has a lot to do with last week's topic, where we were looking at the trunk rotation test from TPI and how we include that into our assessment along with many other things that we look at to get a good understanding of the trunk as a whole, its mobility, which parts are not moving so well and for what reasons, as well as how does that affect the extremities and the mobility at the extremities. So all really important stuff. Today we're going to touch on a few of those concepts again, but we're going to look more into the kind of performance side of the training. We're not going to talk so much about the early stages of the mobility game on the gym floor. We'll definitely show you a couple drills for that, one that you've seen before and then a new one, and then how we translate that still in the gym to more of a dynamic movement. We'll get back up on our feet. We'll get some power involved, and then what can we do on the golf course when we've opened up some thoracic spine rotation and some rib cage space and we're able to rotate a little bit better? What is one way we can go about just feeling what it's like to actually use that rotation on the driving range or on the golf course, and then how you can start to practice with it now and kind of own it, and then work that back into your swing now with access to a little bit more range of motion and less need for compensation. So that's what we'll talk about today. Let's dive in. So at this point, everyone knows it. Golfers, swing coaches, rehab professionals, performance professionals, everyone knows thoracic rotation is important, right? Especially for golfers. Again, refer to the seated trunk rotation test, the last podcast, golf episode 20, I believe it was, as well as the previous blog article. And we can learn a little bit more about how we assess and treat a little bit of that trunk rotation. But today we are going to touch on a couple of those things and then talk about the performance. So how do we measure spinal rotation? If you listened to the last episode or read the last blog article, we use TPI's trunk rotation test. Check out the video. But we need to know more. So if someone is coming close to failing or they're failing that trunk rotation screen, then we know, okay, we need to take a deep dive into the thoracic spine, the lumbar spine, and the rib cage and all the muscles and joints involved there. So we'll use maybe like a lumbar locked type testing motion. Again, check out the last article for a video of that. Or, and from there we have something to really compare it to because it's a little bit more specific. It's more kind of accurate and reproducible, so we know to compare to that, and it really locks out and isolates the thoracic spine for us to measure. We'll skip and we won't talk too much about the muscle involvement and how we assess for the muscle hypertonicity and tightness, and then what we're looking at from the rib cage and how we address the rib cage. Focus mostly just on that thoracic spine for now, and that's something that we would do. That's one test that we would do, that lumbar locked position, to get a really good sense of what's happening there at that thoracic spine. Now, how do we go about improving it? Again, that last blog article and podcast episode will do you good to get a lot of good information on that. Let's touch on a few things here. First of all, it really depends on the golfer in front of us and how we start addressing this. That being said, a really good way to start is with this kettlebell T-spine rotation drill. Now, this isn't where I'd start anyone that came to me. We do some hands-on work first, some soft tissue stuff, some chiropractic assessment and adjustments, and really help us along the way and get things jump-started. And then maybe some breathing drills, especially to really start opening up the rib cage and the thoracic spine in that way, which is also really good for working on getting improvement in extremity range of motion too at the shoulder and the hips. But after we look at all that and do a lot of those things, this is kind of another good passive way of getting rotation back into that spine, especially any that we've opened up with the breathing drills. So I'll show you what this looks like. Again, we are getting separation from the trunk and the hips, as well as getting good and kind of putting ourselves into more thoracic rotation, or really trying to maximize our thoracic rotation, but not at the expense of compensation. And so again, we are working on separating the pelvis from the trunk as we do this. So let's take a look at that kettlebell T-spine rotation drill. Okay, for our kettlebell thoracic spine opener, what we're going to do is we're going to pick a side. We're going to lay with our bottom leg long and extended, our top leg is going to come up to 90 degrees of hip flexion, and we're going to place that on an object that's going to give us feedback. So we want to make sure that this knee never leaves this foam block. Again, my hip stays at 90 degrees or higher. I take a kettlebell. I want to go top side arm towards the ceiling. This back side arm and shoulder can relax out to the side. And I'm going to let this weight help me as I rotate down towards the mat. Okay? From here, we're not letting this left knee leave this block. Otherwise, we could just cheat, and we're not getting much thoracic spine rotation from this. What I want you to do is start in this position. We're going to move it into as much rotation as we can before this knee comes up. We're going to hang out here for a breath. So a breath in through the nose, out through the mouth. And then we're going to go back to the start. And I want you to repeat that 4 reps. We can increase the load on the kettlebell, whatever's comfortable for you, as we continue to move into more and more thoracic rotation over time. We then just switch and do the same thing on the other side. What this looks like from the side, bottom leg stays straight. This hip's getting towards 90 degrees or higher. I'm going to grab my kettlebell. We're hanging out here first. I don't let this knee come off the block as I rotate down, and we breathe in this position. Always reaching towards the ceiling. And then back up. And we're doing that for reps. Right, go ahead, give that a shot. Now that's kind of a passive way to improve our thoracic rotation. We're letting gravity do the work. We're really just trying to sink into it and own it and be comfortable there. To include a little bit more of an active version of it, we're going to go from laying on our back and our side. We're going to be in a half kneeling position now instead, and we're actively going to kind of fight against gravity while rotating ourselves through the spine and laterally flexing and extending at that spine. So we're really working into 3 ranges of motion, or that kind of triplanar mobility through that thoracic spine in this drill. But it's nothing too intense or dynamic. Again, it's just taking what we've kind of opened up passively and starting to use it actively, starting to learn what it's like to actively use that. So I'll show you this half kneeling thoracic spine drill where we're using the foam roller and the wall. Okay, this is a great drill for starting to open up our thoracic spine, create some rotation back into our mid-back. At the same time, we're working a little bit still on creating separation from our pelvis to our thorax, really important for the kinematic sequence and any sort of swinging sports or exercise. Right, so what we want to do in this drill, for this example, I'm going to have my far side knee from the wall forward. I'm going to pin a foam roller to the wall using that. What this does, it'll lock or prevent a certain amount of motion here at the pelvis. We're still getting some, which is good, but we are limiting how much we are excessively using that lower extremity, pelvis, and hips to do this motion. From here, hands behind your head. First thing is try to clear this wall with your elbow, and then rotate your face and chest towards the wall, and then bend away from your front knee as far as you can as we rotate through. Then you can come back up. What I want you to do is breathe through this as you do it. So breathe it in through the nose, out through the mouth. I'm going to hang out here with a breath in, breath out, and then coming back to neutral. Again, anytime you lose contact with this, for whatever reason, you need to reset, maybe you've gone too far. Making sure that we're always applying a little bit of pressure than this knee to this foam roller into that wall. Okay, go ahead and give it a shot. Now, of course, these are just 2 drills that we would do. A lot more needs to be done. We would really progress these things and some other things to get us to the point where we've really opened up a lot of T-spine rotation. But again, just 2 places to start. You understand kind of the reasons why. One's more passive, one is a little bit more active after we've done some more hands-on stuff and some breathing stuff. That's kind of the natural progression. Now, how do we translate this thoracic spine mobility into the rotation needed at the golf swing? Well, we need to be a little bit more dynamic now. We need to mimic golf positions, right? We need to be able to access that range of motion from those positions. We need to be able to access it at speed and with a lot of power and force and timing. So we need to make sure we really mastered our motor control in this range of motion so that we can start integrating it into our swing, right? So that we can still work on our timing and different things like that, and that we can get into these back positions and then work on not compensating like we had to in the future. So we have some patterns that we have to unlearn now that we've opened up some motor control, or some range of motion there at that thoracic spine. So again, it's all about that kinematic sequence. You've seen it before, but I'm going to show you that video here right now that you can remind yourself of why it's important to get separation like we were working on in those earlier drills, and then why it's important to kind of hone our ability to use this thoracic rotation so that we can, again, incorporate it into our timing. And then dynamically, we need to be able to be dynamic with it. Stretch shortening cycle, again, that's all part of that kinematic sequence. Let's take a look at that now. Okay, so what is the kinematic sequence in the golf swing? Kinematic sequence is the one thing that translates between any of the top golfers. Though they have different swing characteristics and different things you might see on video, there are some things that are consistent between all the great ball strikers. One of those things is the way the body moves and the order in which it moves. Okay, so one important thing in the kinematic sequence is understanding what moves first. We're really going to start here mostly at the top of the backswing. So once we get to the top of the backswing, what moves first as we start to come back down? The answer is the pelvis. There's four things we're looking at: the pelvis, the thorax, the arm, and the club. Okay, so what we want to know at the top of the backswing is, can you create separation from your pelvis and your thorax? Because we need one to move relative to the other. We also need to make sure that it's the pelvis that's moving first. Once the pelvis starts to move, it's also the first to start to slow down, because as the thorax comes around, this starts to slow down as it slingshots our thorax. Next, after the thorax, to start moving, is going to be our shoulder. We need to make sure we have good shoulder range of motion, that we can get into that last end range piece of motion here in this right or backside shoulder. So after our pelvis stops, our thorax comes along, and then it's our shoulder that will start to move as well. And the last to get slingshotted is the hand and the club. That's the kinematic sequence in the golf swing. Great. So how do we go about taking advantage or working towards that kinematic sequence of being dynamic with our new mobility? Well, I got 3 drills for you here that we can try that will bring us in that direction, right? So we're still in the gym. We're going to start in half kneeling position. Then we're going to get more upright, more golfy, and then again, even further still, golfer position using rotation, but at the same time, feet flat on the floor, being able to transfer power from the feet, from the ground up, while we're using that new mobility through the spine. So we're really starting to practice and integrate things together. Let's take a look at these 3 exercises and drills. Okay, for this exercise, we need a light med ball. We're going to be in the half kneeling position where we have one knee down. We're going to be tall through our hips. And then our front foot is going to be flat on the ground. For this exercise here, we're working on bringing the ball from one side up over our head and then slamming down towards our backside leg. We can also do the same thing where we're starting here on the side where our foot is back. And we're going to bring up overhead and slam towards this top side foot. Again, it just depends on the programming here. You can also alternate between the two and then switch your legs and switch which one's in front, which one's in back. Again, as we go through this, we want to focus on keeping that ball long and tall over our head, and then using our core and obliques to really crunch and rotate down through the spine here, creating power as we do that, giving a full follow through on that med ball throw towards the ground there. Okay, give it a shot. Okay, so this is a side step up with lower body rotation. Great drill for strengthening our obliques, but also gaining that lower body, upper body dissociation. So what we want to do is we can start without a weight. All we need is a surface to do a side step onto. What we're going to do is, as we step onto that surface, we're going to rotate our body towards the side we're stepping. Lower body, our upper body stays oriented straight, either square or a little bit in the opposite direction of where we're heading, okay? So what this is doing is teaching our upper body to be able to stay stable as our lower body moves below us. What we can do to progress this is grab either a dumbbell, a kettlebell, or a medicine ball, and we can start light. What we're going to do is that same thing where we're going to step up, keep this ball out in front of us, okay? Making sure that as we're stepping up, we're not rotating with our lower body. It's really important for being able to learn how to be strong while dissociating our upper body from our lower body. Just like that, do both sides. Okay, this is our medicine ball shovel pass. Few key things with this exercise and drill is, first of all, the motion is going to be from here and through. What I want you to think about when we're doing this is not to let your hips just follow through weakly like that, but instead I want you to think about avoiding something like an early extension where these hips shoot forward. And instead I want you to think this lead side hip, in this case my left hip, I want you to think of it as shooting back as we come through, so that this hip is behind my lead heel, right? So instead of coming through like this, I want you to think of driving this hip back. You can almost see as if my foot would come and slide back, but the friction is going to keep it there. So instead my hip comes back like that as we shoot and explosively throw that ball through. Again, avoiding this weak hip moving forward, but driving through, getting that hip back and keeping that hip back. Give it a shot. Fantastic. So after spending some time doing that, and we are in a position where we really want to transfer to the golf course, well, now we need to actually swing the golf club. There's a few things here at Integrated Rehab and Performance Center. We don't really give out swing drills. We don't try to correct necessarily very specific swing faults, but we want to give your body the ability to be corrected, so that you can actually correct those issues. So we will give a swing drill here and there once we've worked on the body, but again, this isn't necessarily to fix any sort of characteristic. It's just a way for you to get a club in your hand on the golf and the driving range and learn what it feels like to cue and focus on that thoracic rotation, right? So it's just a drill to emphasize rotation through your mid-back thoracic spine. Take some swings there, and then after that, go back to your normal drills, whatever you're working on, your timing, whatever it might be. But you've just learned how to incorporate a little bit, how to actually go about using it without having to compensate now, right? So that it just translates it to the golf course. So you have it, and it's like, okay, now it's time to work on incorporating it further. But we need to learn what it feels like with the club in our hand to actually access that range of motion. So here's a drill that you can do. It's very simple, that will start that process of creating separation with that club in your hand, and then just, again, accessing all that new range of motion and just feeling what it feels like to be there and to have it and not need to compensate to get into that position anymore. Okay, for this drill, all we're trying to do is transfer the sensation and the use of space that we've opened up in the thoracic spine and rib cage. Is we want to transfer that to the golf course and onto the driving range a little bit for you. So we use this drill to help create that sensation, to help you use all that space that we've opened up, to transfer it into that golf swing a little bit on the golf course, right? So for this drill, to help with that transfer process, what I want you to think about doing is imagine you have a band around your knees that are pulling your knees together. When you set up for the swing, I want you to push your knees out. I want you to keep full foot contacts on both sides. So I don't want you coming up onto your side of your foot like that or anything, but I want you to keep full foot grounded contact, and then push your knees away from each other, or at least feel like you're pushing your knees away from each other. From there, I want you to maintain that as you rotate up through here. I want you to think about keeping a nice stable pelvis, right? So I have this knee pushing out, so when I try to rotate towards this side, I end up pushing through this foot, which is kind of trying to push me back. What that does is it helps kind of lock this pelvis and everything below it, locks it up a little bit, so that we have to rotate more through the thoracic spine. And I'm a little bit stuck in what I can do here, but same idea goes. When you're out on the range, I want you to think pushing your knees apart, keeping your foot grounded, limits how much we get from that pelvis and below, so that now we can really focus on what it feels like to rotate throughout that thoracic spine. Just keep like a little 4 out of 10 pressure of knees away from each other, pushing your feet into the ground as you rotate, and just feel that thoracic rotation through your swing. Take a couple swings like that. Again, just feel what it's like to get all that motion coming from that low back and up, and take a couple swings, see how it feels, see what it feels like to actually use all that space that we've opened up in that thoracic spine and apply it to the golf swing. Then go back to your normal swing, whatever other drills you're working on, and forget about what you're doing down here. Let everything else go natural, and you'll be able to kind of transfer that thoracic rotation a little bit better into your swing. Give it a shot. All right, so to wrap it up, The treatment for addressing thoracic spine rotation in the golf swing, it'll look different for every single golfer that comes in. If there's pain involved, now we have a whole host of different things that we're doing, and we're kind of starting from a different point. But again, the general ideas involved in what we talked about today all apply. That's kind of the train of thought. As we move forward, people move at different rates. But again, same idea with each golfer, trying to translate everything we do in that rehab space, performance space, into and onto the golf course, no matter where they're coming from, right? So we're always trying to work towards that direction here. So thanks for listening today. Hope you got a lot out of it. Try these drills. Take a look at last week's episode, whether it be on the podcast, Spotify, or YouTube. Check out the blog article for some slightly different takes on it and wording on some certain things. And give these things a try. Just put these last 2 weeks together, and you'll have a decent little routine that you can try to get some rotation back into your trunk for the golf swing. Thanks for listening. We'll see you next week. Bye.